Thank you everyone so much for allowing me to be here and speak with you about a topic that some of you are already familiar with, but for others, you might just be starting the journey. The twist that we're going to talk about today is something that is very seldom discussed, and actually there is no research on the last point of my presentation today, which is the grieving process for the loss of self versus the loss of a loved one when you're caregiving for someone with any type of neurodegenerative disease. So I want to be clear here that the topic does not specifically pertain to individuals with Alzheimer's disease, but anyone with any of the diseases that we treat here at Cleveland Clinic, LouRuvo Center for Brain Health. I also want to preface my presentation by saying that we are going to get incredibly heavy toward the end of this presentation, so I want you to be aware that there are tissues at the front of this room. If you need them, I want you to understand where they are because I have conducted this presentation with social work students, all of whom cried. So this is a topic that is not to be taken very lightly because it is something that I deal with day in and day out. So thank you again for having me. As Susan mentioned, my name is Samuel Hickson and I work in the Patient and Family Services Division, most commonly referred to as social services. And yes, I am a social worker, so I am typically the person that you'll speak with when you are at wit's end. Today, I want to talk about, again, the overall process of caregiving. So we're going to really look at those rudimentary, elementary parts of caregiving, talking about the value of caregiving, the challenges prevalent in neurodegenerative disorders, again, not just focusing on Alzheimer's disease, but all of the diseases that we treat here. We're going to talk about the framework of de-escalating when your loved ones provide conflicts to you. We're going to talk about how you communicate as a caregiver. That seems to be the biggest thing because there's a difference between speaking and talking and communicating, especially with someone who can't understand, comprehend, remember, or interpret what it is that you're saying to them. And then we're going to talk about the last piece, which is the heavier part, and that's going to be death and dying for caregivers. I believe some of you heard Dr. Donna Munich-Miller speak about the statistics related to caregivers. We won't get into that because you're probably going to cry enough during my presentation. So with that, I want you to be aware that we're going to talk about something that's not commonly discussed, and that's death and dying for the caregiver, not the loss of your loved one that you're caring for. So before we begin, I want to introduce you to a video. For those of you that don't know, HBO did a documentary series on the Alzheimer's Project, and I do need to bring this up for a second, but I want you to look at this about 8-minute segment of this 40-minute documentary because I think it is something that is so familiar to those of you that are already caring for someone with a neurodegenerative disease. But for those of you that are not, it will be a very real introduction to what you're in store for. So I would like to show you the story of Nacho and Mike. Nacho is the patient with Alzheimer's disease and Mike is his son. But I want you to listen very carefully to how Mike experiences his relationship with his father at this time. And just to let you know, Nacho is at a little bit more of an advanced stage of Alzheimer's disease compared to what some of you might be dealing with, but the experience of Mike as a caregiver is something that you all may have experienced or will experience in the course of this disease.
Essentially, I had an 82-year-old son.
Yep.
It's an adjustment.
You've got 6 brothers and sisters. You run a business. How did you wind up with a caregiver?
Well, I don't think you choose to do it. I think it's just something that falls into your lap. You know, it's my father, so I just wanted to do whatever I could to help him out. I had 2 extra rooms in my home and moved him in. There's always adjustments that you're making. We'd give him little puzzles, or have him play games to where he can win.
There it is, back there.
And when he wins, he still feels like he's got it.
Good job, you won. You won the game.
That builds self-worth as well, because otherwise, what happens is depression starts to set in. Maybe for a month or 2 months, I think, oh, I can do this for 10 years, 20 years, no big deal. But they don't let you sleep at night sometimes. They're wandering the house, they're making noises, they're trying to walk out the front door, taking showers in the middle of the night, and all the things that are typical of the Alzheimer's patient. At first, we took him everywhere. We took him out with us all the time. And then over time, it just became, more than he could handle as well. He doesn't like crowds, he doesn't like a lot of noise, and that's typical of the progression. And so over time, he became more of a person that just wanted to stay home, or that was better at home. And so you learn to say no, you learn to just not go. I actually gained 30 pounds just over those 2 years, which is a lot. 15 pounds a year is a lot. And I have high blood pressure now, so I have to deal with the high blood pressure. And so all of that takes its toll. It just throws you out of your routine. I think that's one of those lessons that you learn as a caregiver. You're no good to them if you're sick. People started to explain to me that I couldn't do this forever. Don't worry about it. There'll be a time and you'll know. And you always ask them, well, how do you really know? I said, oh, you'll know. And so it's hard to explain to somebody with words until they've been through the experience. But now that I've been through the experience, I know exactly what they mean. Time to get up. Come on, Pops, we're getting up, okay? It's really traumatic, I think, for my dad. And so the first couple months were really, really difficult, and there's still plenty of challenges ahead. How you feeling? Pretty good? Interestingly enough, all the things that I had experienced with him, they began to experience with him. We know that if you just don't drop them off somewhere, everything's fine. Okay, come on, follow me. We gotta walk the dog. Okay, we're gonna go over here. Okay, Pops? Over here to the park. Yeah, keep walking this way. Okay, watch your step here, okay? There we go. Okay. Come on, Gina. Right over here. Gina, come on. Uh-oh. Come on, I'm stay. Stay put. Stay put. There you go. You waking up? You feeling good? Now the problem that we're facing is that he won't sleep through the night, and he's disoriented when he wakes up in the middle of the night. He doesn't know where the bathroom is, so he urinates in the kitchen or the living room. He just doesn't understand where he's living. It kind of spirals, feeds on itself. So that's what we're dealing with right now. And now, because he won't sleep through the night, we've had to hire someone, a cost of $100 a night, just to watch him, to make sure he doesn't disrupt the other residents and the other caregivers. As you can imagine, 30 days a month, $100 a night, $3,000.
Papi, te vine a visitar, ya viene Michael y los otros. ¿Tienes sueño? When he's awake and when he's, alive, he's alive. I mean, he's just great. Okay, please wake up. I came to see you, Daddy. Okay, wake up. Despiertate.
Okay, so this is kind of the follow-up meeting to the meeting we had a few weeks ago about my dad, and so we want to kind of see how switching doctors and maybe switching a little bit, mixing up his medications might help.
And I know last night he was up twice and doing what he usually does.
Yeah.
So
we're gonna take him to the neurologist this week, but he did talk to me about his medications,
Okay.
and he was going to increase the, I think the Risperdal, right?
A lot of medications that this type of patient is on can cause a lot of side effects, one of which is insomnia.
He made it sound like he had some immediate adjustments that he could make to help out with the nighttime stuff, but you know, I just don't, I really don't know. I mean,
Once we get these other doctor's appointments, it'll give us a better grasp on where he's at and the direction we're going to take, okay? And I think he'll finally settle down after that. I mean, we've seen it before, and we've never not been able, you know, to get it under control. I'm confident that things are going to work out fine.
yeah, you know, maybe he's adjusting. It's been 4 months. I've been told it takes as long as 6 months. You know, my girlfriend at the time, I gave her a little puppy. He was 8 weeks old. A friend of mine had a litter, and so we got her a little Yorkie. My dad loved playing with the dog, and yeah, it just brought a lot of life out of him. So he just became more animated, and just made things, you know, the whole household a lot happier. She ended up moving out. It was just put a lot of strain on the relationship, and you know, people have warned me that you know, moving my dad in put a lot of stress on all my relationships with my friends and family and stuff. And yeah, but probably about 15 months into it, she decided to move out. Got you some ice cream, Nacho?
Well, this is not meant to be a film session. I wanted you to hear the last part of that part of his girlfriend moving out. As we go through this presentation, I want you all who are caregivers, whether you are experienced or starting out, I want you to think about what it is that you have lost since becoming a caregiver. At the end of my presentation, it will make a lot more sense as to why I am asking that question. But while we're going through the presentation, I want you to think about what has becoming a caregiver done to your relationships with your friends, with your family, with the one that you loved, whether or not they're dealing with this disease. Because while some of you may be in denial to think that you haven't lost something, I can guarantee you probably have lost something. And at the end, we will talk a little bit more about why that statement will make sense. So this is a little ad that I got from Susan Hirsch, who was the previous director of my division, about Caregivers Wanted, and it reads, "Person must be willing to work long hours without pay, no vacation, and few, if any, days off. Must be willing to relocate life from expectations of normality and feelings of control to constant stress accompanied by feelings of inadequacy, anger, guilt, and fear. Previous experience unnecessary, on-the-job training only. No need to apply, unqualified applicants chosen at random and without their consent. Stroke is an equal opportunity employer of caregivers, men and women, young and old, healthy and sick. All are eligible. Contrary to popular belief, because we are human and because as women you might be able to bear children, you are not caregivers. We are not bred to be caregivers. Just because we might feel emotion and we might understand how to empathize and sympathize with people, that doesn't make us experts or qualified to care for someone dealing with a neurodegenerative disease. Although some might make it seem easy, those of you in caregivers or in the caregiver role can attest to the fact that at some times it is very challenging and very difficult, and you do get angry and you do feel guilt and you are very frustrated at your experience, oftentimes asking, why me? Why is this happening to our family? Some people like to believe that we are superheroes because we care for people and might make it seem seamless because we don't showcase our emotions on the outside. When we're frustrated, most people don't see us tossing glass across the room or breaking dishes, although we might want to. We might want to yell at our loved ones and say, I just wish you could be normal for 5 minutes and give me a moment of 5 minutes for peace. But we don't. And unfortunately, the world sees us as superheroes because of that, because these are all the roles that we undertake. We are the care provider. We are the advocates to people who cannot voice their concerns. We are the problem solvers. We are the confidants. We play the essential roles in the lives of our loved one that they can no longer do. But understand that there are influencers on our ability to do our job as caregivers. There are cultural expectations. I can't tell you how many times I've had clients sit in my office and tell me, well, I'm the wife. I'm just doing my wifely duty. Because you're from New York and you might be from an Italian Catholic family and that's what you've been told to do. You're supposed to honor your husband or you're supposed to honor your wife, regardless of how frustrating the times might be. Your religious beliefs dictate that you cannot get divorced, although you might want to. You might say, I'm done with this, as has been the case for many of my clients who decide they want to just drop their loved ones off in the front of a homeless shelter. There are health, as Dr. Munich Miller stated, and I know some of you don't want to hear the statistic, but 63% of caregivers die before the ones they are caring for. You have family structure issues. Sometimes your children just don't want to deal with it, or they might be in denial that their mom or their father has any of the diseases that we treat here, whether it be Alzheimer's, Parkinson's, multiple sclerosis. They don't want to hear it. So your family structure changes. Geography. Unfortunately, for some of you, Las Vegas is not the place you want to be if you have a neurodegenerative disease. We have to be realistic about that. Yes, as Cleveland Clinic, we are very great at what we do, but the resources only go but so far. When you have the law telling you you can't do this or you can't do that, or I'm sorry, you have to wait 5 months to get disability, even though you were approved 3 months ago. And there's wealth. Some people have the means to accommodate the disease while others do not. And what are the financial burdens that are placed on you to care for someone that you love? As you heard from Mike, it costs $3,000 a month to have someone move into the facility with his father to do what the facility should be doing. $3,000 additional dollars on top of what they're already paying for someone to care for their loved one. So this is how we really look as caregivers. This is what goes on the inside when the world sees you as a superhero. You want to say, sorry, this is my life right now. I might have a smile on my face, my hair might be done, my nails might look nice, but I really want to rip my hair out. But I don't have time for that. You don't even have time as a caregiver to rip out your own hair, because you need to be an advocate and a problem solver and everything to your loved one that they can no longer be for themselves. So there are many challenges. I don't have to tell any of you that who are sitting in this room in the role of a caregiver. Your relationships went bye-bye. No more friends, because they don't understand why your wife or your son or your father or your daughter or your aunt or your uncle are pulling their pants down in the middle of a restaurant. They don't understand why they speak out of turn at the dinner table. And they don't want to deal with that. There's the burden of care. As LouRuvo can attest, his mother went through an extreme amount of stress to care for his father, to the point that she is now confined to a wheelchair or needs a walker to aid her in movement. There are financial stresses. Again, I don't have to tell any of you that. There are doctor's visits, there's medication, there's long-term facility stays, respite care that you have to worry about, diapers that are not cheap, but you need to prevent your loved one from using the bathroom in your kitchen. There's the support network. Where is it? We like to say that we have associations here that can help you, but again, those resources are limited. Why? Because the law doesn't understand the disease that you're dealing with. They can listen to every doctor in the world speak about what this disease can do. They can hear every expert testify on what the disease can do, and yet here we are. We're still waiting 5 months to get disability benefits. Safety. You're worried about your own safety for your loved one who becomes too demented to realize that you are not stealing from them. So what happens when they decide to pull a gun on you, as is the case for 2 of my clients? Or they decide that they want to wander while you sleep. So they leave the house, but unfortunately, you didn't know to get a medic alert bracelet. Or you didn't think to put up chimes around your house to be alerted because you're too tired to stay up 24/7. So they decide to open the lock because that's the one thing they do remember how to do and walk down the street. and get lost, or they decide to get into a car and drive down a one-way street in the wrong direction. But unfortunately, the Department of Motor Vehicles says they can keep their license. There's your health. There's the health of your loved one that you're caring for, because unfortunately, at this time, we don't have a cure for the diseases that we work with. And as somber as it might be to say, they will get worse. It might be 2 years, it might be 5 years, it might be 10 years, but ultimately this disease will do exactly what it wants, and that is to claim the life of your loved one, if it doesn't get to you first. And lastly, there's the loss of identity, which is the part that most people don't discuss when they talk to caregivers. They talk about you caring for your loved one, but what happens when the person you were goes bye-bye? What happens when Gina and Sally and Jeff and Tom are no longer the people that they used to be? Because you've lost your identity in the process of becoming a caregiver. But again, you don't have time to grieve for that. And there are, of course, unique challenges, behaviors. Some of you have dealt with this before, some of you have not. There's sundowning, and you're trying to understand why your loved one gets worse as the sun goes down. But no one ever told you that they have sundowning. You're just thinking it's a part of the disease progression. But every time 6 o'clock or 7 o'clock comes, their behavior becomes sporadic. And now you don't know what to do. And every day it's a different behavior. There are communication issues. What happens when your loved one can't remember how to speak or comprehend language? And you become so frustrated because they want to tell you what they're feeling, they can't get the words out. Or you really want to tell them that you really just want them to be normal for 5 minutes, but you know that they can't. And you know you can't use those words, because what is normal? What is normal? Every person goes through the process of Alzheimer's disease, but no two cases are exactly alike. If you've met one person with Alzheimer's disease or Parkinson's or multiple sclerosis, then you've met one person. In the activities of daily living, there will come a time where you have to wipe up after your loved one. There will come a time when you have to wash the sheets on a daily basis because they couldn't remember to get up to go to the bathroom, or they couldn't physically get up to go to the bathroom, or their body no longer tells them, you have to go to the bathroom. So now you have to go around and clean up, but you're tired. But wait a minute, they need breakfast, and they need lunch, and they need dinner. And you have to clean up the house. And you have to make sure that everything that operates to make sure they have some type of quality of life is circling in a very seamless motion. But there are rules of the road that we tell every caregiver, right? We always say never argue, because they don't know that what they're doing is wrong. They forgot that they shouldn't use profane language when speaking to the one that they love for 65 years. Never argue. Give information. You have to tell them over and over and over that this is why we're doing this, this is why we're doing that. Don't you remember we have a doctor's appointment today? Don't you remember the doctor said to take your medication? And then we tell you therapeutic lying, right? It's okay to lie because they're not going to remember. And it's a useful technique. It is. But at what point does that become ineffective? Because now they've progressed so far that they've become belligerent, or they have just simply withdrawn from life. So they don't talk to you at all. And then you redirect, as is the case of one of my clients who loved his BMW that he just bought, that they need to sell it. How do you get that sold so that he doesn't become angry and belligerent? You redirect. Don't you remember we put it in the shop? Because you pray that they forget. But there are moments when they're lucid and they remember, oh, when are we getting our car back from the shop? Then what do? So oftentimes we require our loved ones to do the changing. We want someone who is demented to change. We want someone who has Parkinson's disease or Huntington's to change. We want someone with multiple sclerosis who is in constant pain or depression to change. Very seldom do caregivers realize that it is us that has to change. There's a part of us that has to go bye-bye so that we can care for the ones that we love. So rather than do this, we need to do this and balance the scale. But there are de-escalating frameworks that can be used. As caregivers, we have to understand what sets our loved ones off, what makes them angry or what makes their memory worse. If you pay close attention, you will realize that people as humans naturally develop patterns. Something always causes something. So every time your person or your loved one gets upset or angry at you, why is this happening? Keep calm and assess the situation. Don't throw glass across the room because it will solve nothing except now you have a broken glass you have to clean up. So you have to stay calm, as hard as that might be, and understand what is happening. And if you don't understand that, seek medical help, because it's something about the disease that is not clicking with you. Respond with compassion. Your situation, for all intents and purposes, is hell on earth. But there are good moments. There are good moments because your loved one is still here. The disease is something that they have, but it doesn't have to be who they are. And unfortunately, as caregivers, the biggest mistake that we make is treating them as their disease. But they're still a person. They have feelings and emotions. You may not be able to understand at the time what emotion it is that they're expressing, but they still have it. So respond with compassion. And manage your tone. Don't talk like this if they're yelling at you, because they can't understand what they're doing. So you have to, again, remain calm and keep your tone calm, because they might be demented, but their human instinct is to defend themselves. That is something that they will never forget how to do. If you yell at them, their instinct will be to defend themselves. And de-stress yourself. Chinatown is very close. Their massages are $20. I recommend you utilize them frequently if you must. Go in the backyard, take a minute to breathe, meditate, do yoga, anything you can to de-stress yourself. And then process. What did you learn from the interaction? What we have a tendency to do as humans is say, I'm done with this, now we have to move on. But there's always something that you can learn from your interaction, good or bad. There's always something that you can learn. So there's the toolbox, which I'm sure many of you have seen. But what I want to draw your attention to is this box right here, which I don't think you can see, but here, it's empty. And that's purpose, because every situation is different. I could stand here for an hour and tell you what I think I know about caregiving, but the reality is when you walk off this campus, you are now on your own. Of course, you can call my office, and I can try to walk you through the process, but you have to learn what tools work best for you. Because your wife or your husband or your daughter or your son or your brother or your sister is not going to respond to every technique that we give you. So it's important that you develop your own toolbox, which is why we leave space. There are some things that are important: flexibility, creativity, laughing at your situation, which people don't like to do because they think it's not funny. You're right. But what's your alternative, being depressed and angry all the time? So you have to find what works best for you. So our message is that it takes a village. You cannot do this on your own. And every day I have somebody telling me, oh, my loved one doesn't need help yet. You're right, but do you need help? Because unfortunately, they didn't hear my initial question. I'm asking, how are you doing today? Not how your loved one is doing today. Of course, I care about that, but in the moment, I'm caring about you. And unfortunately, caregivers seem to think they can do it all on their own. Again, because of cultural expectations. This most often happens with men that don't like to ask for help. But sooner or later, they do. And that's good. So there are communication strategies for every caregiver, and I really encourage all of you, it should be in your packet, to really look at this. I don't want to beat a dead horse because I think you've heard it a lot, but you want to make sure that you're listening. Planning is the biggest aspect of communication because you want to learn those triggers. and you want to make sure that you're not using them over and over again. You want to match your communications. Of course, focus on the body language. This happens, and this is a technique that a lot of caregivers overlook. Body language is important when your loved one loses the ability to speak verbally. I always hear people say, well, my loved one can't speak. That doesn't mean they can't communicate. Their body language is telling you something, and you're just not listening to it. A lot of times people have animals. Anyone have animals in here? Dogs, cats, birds? They always alert you when something is wrong. Always. Their behavior becomes sporadic. And what I tell my clients is put your animal in the room with your loved one and see how they behave. If the dog cowers for no reason, there's something going on with your loved one. They're sensing the emotion, but unfortunately, we are not trained to read body language, so we overlook it. Offer solutions to yourself and to your loved one. Don't argue with them. You're spending so much time trying to get them into your reality, as Dr. Esther Langston put it. They don't want to be in your reality. They're in their reality. So you need to step into their reality and come up with solutions that are beneficial to them. And understanding that the process is circular. It's never going to be you're going to start, end. Start, end. Sometimes you're going to jump back. Sometimes you'll jump to the middle because something you did there needs to be corrected. So the process is cyclical. It's never linear. And there's the decision tree. I think you guys all have seen this as well, where you're looking at the diagnosis. What do you change? What do you accept? The symptoms, what changes? What do you accept? And your expectations is the biggest thing I want to draw your attention to. Some things have to change, and you need to accept that. It's hard. I would like to say that there's a magic formula for caregiving, but unfortunately there isn't. So, unfortunately, you didn't have the choice to become someone's caregiver, but they didn't have the choice to choose you either. So there needs to be a mutual understanding that you are both in it to win it. I always like to say the fight isn't over until your loved one is 6 feet under. Until that doctor puts a toe tag on there, you keep on fighting, because that's what it's about. You don't know what tomorrow is going to bring, and it may very well bring a cure. But for some of you, you have given up. And that's okay to feel that. It's normal. But tomorrow is a new day, and we might have a cure in this new day. Keep calm and eat chocolate, which is my favorite. Dark chocolate, preferably, because it's good for brain health. But it's okay to have a cheat day every once in a while. Unfortunately, Mike gained 30 pounds in 2 years. That doesn't have to be your story. Dark chocolate is really good. Have a small bit of it. It helps out. So now we're going to do the exercise that's going to make some of you cry because it's going to be a little real. There are tissues in the front. I must preface this. You should have received 2 pieces of blank paper. On one end, on one of the pages, I would like you to write your name, and if you are caring for someone with any of the diseases that we treat, if you could write your relation to that person. So your name, and if you are a wife or a daughter or a sister or a friend, I want you to write that on that. Very big. Our remote sites, you may not have this, but I want you to mentally do it in your mind. Basically, right now, we're just writing who we are today. Your name and your relation to someone that you care for, if you care for them. On one of the pages, and on the second page, I would like you to write the word caregiver. And I want you to write it really big. We'll recycle, by the way, so you don't have to worry about what we're going to do. We're going to recycle the pages. Has everyone done that? Remote sites, I hope you have it in your mind. Now I want you to take the first piece of paper that has your name on it and your relation to that person, and I want you to rip it up. Now I want you to take the second page that says caregiver, and I want you to hold it up, just like this. And it's okay, I don't have to see it, just hold it up. For some of you, the reality of your life is that the person that you were is now long gone. Now, the world recognizes you as nothing more than the caregiver of your loved one. They don't remember that at one point you had friends, you had a life, you had a career. Now they see you as the caregiver because you have assumed every role to make sure that your loved one is safe, except the one that you started with, which is who you were. I can't tell you how many times I hear, my wife is not my wife anymore. My husband is not my husband anymore. My father is no longer my father. Why? Because they have a disease that robs them of their memory? It doesn't change your marriage license. It doesn't change your birth certificate. But unfortunately, the world doesn't always see that. So this is how we define self-identity, the recognition of one's potential and qualities as an individual, especially in the relation to social context, taken from Merriam-Webster's dictionary. I love this definition, and I think everyone should embrace this definition. So I'm often asked this question, when will I be me again? Unfortunately, there is no answer to that, or at least not one that I can provide you with, because every experience is different. The time frame is different. For some of you, your loved ones escalate quickly. Others, they escalate very slowly. But if you focus on the fact that you are still who you are, you just have a little bit more responsibility to deal with, that question becomes a little bit more easier to handle. The other part that most caregivers don't deal with is the fact that they are grieving, not for their loved one, but for the loss of themselves. How many of you in this room have felt like you've lost a little bit of something since becoming a caregiver? And it's okay, this is a safe space. And how many of you have engaged in the grieving process for what you have lost? We have one person out of maybe the 6 that I saw raise their hand. So of course, these are the stages of grief. We go through denial, anger, bargaining, depression, and acceptance. And oftentimes, we use this as the model in relation to the loss of a loved one. But your loved one was yourself, and part of you is now gone. Some people try to go work around their grief, but you can't. You have to go through it. It's a natural part of life. You can't go under it, you can't go around it, it's just something that you go through. The problem becomes when you as a caregiver stop yourself from going through the grieving process because you feel like you have too much to do. You have to care for your loved one, you have doctor's appointments, you have to worry about what medication they have to take, you have to worry about what medication you have to take so you don't have time to grieve. But you will, and you'll feel a little sense of relief. And then reality will set in again, and then you go through the grieving process again, and then you get over it, you overcome it, and you become stronger each time. So with that, I would like to thank you for listening to my presentation today. As Susan mentioned, I am Samuel Hickson, social worker here at Cleveland Clinic, LouRuvo Center for Brain Health, and I will now take time for questions. And it's okay, any question is acceptable. Yeah?
I just want to make a comment.
Yeah.
I was a caregiver for 10 years for my mom. And I think I've taken it upon myself to talk to other people who are going through the process and telling them about all the things out there that can help them. And like you said, go through all those kind of steps. Because you lose so much that you never get back. And then to lose your loved one at the end too, it's really hard. My mom, like I said, it's been 5 years, but I was her caregiver for 10. And the worst part, and I think that I've overcome, was family not being there for you. But I did go to another support group, and I'm from Michigan, that said you have to forgive your loved ones and your friends. because they really don't understand what you're going through.
Yeah.
And I can remember my brothers telling me, but I don't want to see her like that.
Sure.
I'm thinking, but I don't want to see her like that either.
Sure.
But somebody has to be there for her because she was a wonderful mom.
Absolutely.
And so you have to forgive. You may never forget, but you have to forgive, and it does make your relationships easier once that loved one is gone.
Thank you for sharing that. And there was something that you mentioned about forgiving. You have to forgive your friends, you have to forgive your family, but the other person you have to forgive is yourself. Because sometimes thoughts enter your mind, you feel guilty, you should have done this, or you think you should have done that, or maybe if I had done this, things would have been different, and you beat yourself up for that. But there's a point where you have to realize that you did not ask for this. No one asks to have a neurodegenerative disease. I don't wake up in the morning and say, I think I'm going to get Alzheimer's today. So you have to forgive yourself for the experience that you go through because you don't always have control over what you go through. And that's the unfortunate fact of that.
I'm not sure they heard that.
Did you hear that, remote sites? No? A little bit?
Yeah, most of it.
Okay, okay. Any other questions? Any other questions in the room here? Yeah.
I'd just like to make a comment.
Sure.
That you have to cherish the good moments because they can further inspire the life.
Absolutely. The comment was that you have to...
Humor. There are some hilarious things that happen.
Absolutely. So the comment was that you have to cherish the moments that you have and also the humor in your situation. The moments can pass by very quickly, but sometimes, even though it's rough, you do have to laugh at the humor because there are some things that are interesting. So with that, do we have any questions in the remote sites?
No, you've been very interesting and helpful to listen to.
Thank you.
Very thorough.
Thank you. Any other questions that we have?
Can I tell you about my humorous stuff?
Sure.
The card thing. I said, oh, Mom, your son needs a second card.
Okay.
Can he borrow yours? She said yes, and then about a month later, she says, where's my card? And I said, I thought you gave it to your son. And she said, oh, I did? Okay. She never asked me again. And the other was, she would say, I'm hungry. She was diabetic too. I'm hungry, you didn't feed me. And I'd say, oh. So the next time I said, I'll just leave her dirty plate on her seat. And she would come back and she'd tell me that. And I said, well, Mom, I thought you were sitting right there. There's a dirty plate. It's empty. Oh, I ate. So yeah, those humorous things really help you get through those days and those things.
Absolutely. Other questions? Yes.
Not a question because I dealt with my mom for 9 years.
Sure.
But what I always tried to do was when she would ask those tough questions, because she didn't remember.
Sure.
I never tried to make her feel like it was her fault.
Sure.
Because one of the things she went through was, I'm so stupid.
Sure.
I'm so stupid. And so I got where I attended some other conferences with the Alzheimer's Association. And they teach you how to talk in code. Because you can never tell when you're going to have that perfect moment.
Sure.
And I always tried not to say things in case she had that moment where, you know, if I was especially like at the doctor's office, I got very good at talking code with the doctor.
Sure.
Because we didn't want her to feel bad. She already, when she did have good moments, she felt bad.
Right.
And so you kind of learn to talk in code.
Absolutely.
And you tell those biblets, as they taught us, taught me and the other. You tell fiblets.
Absolutely. In the remote sites, we're talking here about how we've utilized alternative ways to communicate so that our loved ones don't feel bad, sometimes telling fiblets or therapeutic lying or finding other ways to communicate when our loved ones are in the room so that they're not feeling bad about their situation or about themselves. You know, a common theme that we hear is they feel stupid because they don't understand or comprehend what's going on around them. So there are ways to help combat that or deal with that so that your loved one doesn't feel stupid or say things that might be demeaning to them. So let's go back to the remote sites. Are there any questions or comments that you would like to share from your experiences?
All right, we have a question here in Elko.
Sure.
When my husband was in the convalescent hospital, he was in the bounce back. And he had been on so much medicine because he had got carbon dioxide poisoning from his bad lungs. His oxygen was too high. The liters were too high. And they told me he had sundowners. He just was terrible in the evenings. But it appears that it was medicine because we fought hard and got him off of, I can't remember the name, like Ativan and some terrible medicines. Got him off all those, even sleeping pills, and he was peaceful. And he's home now for about 14 weeks, and he hasn't had any of that sundowners. Is there a possibility it was just medicine?
So that's a good question. The question is there a possibility that it was his medication that created some of those side effects that you're talking about? First of all, thank you for sharing your experience, Elko. Number one, let me preface that whenever there's a medication that's prescribed to your loved one, I always recommend that you speak with the provider or your medical professional to make sure you're understanding everything that there is to know about this medication. Of course, people respond differently to medication. Sometimes when we go through, from my clinical trial days, I can speak, sometimes when we test a medication or we prescribe a medication, some people experience side effects while other people do not. It is possible that there was a side effect of the medication, but I always recommend that you speak with the doctor about that. As Mike mentioned in the video that we were watching earlier on in the presentation, many of the side effects that his father was experiencing with the nighttime behaviors was happening as a result of medications. So yes, sometimes the medications can have an effect in which their mental faculties deteriorate until they find the perfect balance, but it's different for every case. So I certainly encourage kind of those conversations with the doctors if you think that, you know what, I think it's the medication, I don't think it's what you're telling me. It's okay to push back if you really feel that it's the medication and have someone investigate it. There's nothing wrong with you raising the question to your medical professional about that. Short answer, it's possible. Thank you.
Mr. Hickson?
Yes.
Isn't the behavior and the symptomatology of Alzheimer's and all other forms of dementia pretty much similar, and there are crossovers in the behavior?
Sure. So the question is the behavior, you're talking about difficult behaviors, correct? Or just behavior in general?
Behavior in general.
So is behavior in general typical of patients with Alzheimer's disease plus other dementias? So number one, understand that while medically we may know the pathology of Alzheimer's disease in terms of its progression, everyone experiences Alzheimer's differently. Some people, for example, it's been my experience, they could have gone from mild-mannered housewives to becoming some of the most aggressive women I have ever met. Whereas you could have someone who is incredibly peaceful throughout their disease progression. They don't utter words, they don't become belligerent. So yes, in some cases, behavior can be a symptom of the disease as the disease progresses and across all dementias, but it's not the case for every person. So it's, I can't say, you know, every person's gonna become belligerent or every person's gonna become mild-mannered. What I can say is that it's not uncommon for patients with any dementia to experience behavioral disturbances. Oftentimes it's common in dementias like frontotemporal dementia in which they become disinhibited. So yes, it's not uncommon, yes.
But prognostically, is there a significant difference in, you know, the different type, among the different types of dementia? They're all forms of dementia. Prognostically, is there a significant difference? Once a diagnosis is made, be it Alzheimer or be it, my husband's is
a dementia based on vascular happenings.
Yeah. Mm-hmm.
So that, my question is, prognostically, is there a significance?
So the question is, prognostically, is there a significant difference between the dementias? Mm-hmm. Again, it differs by person. There's no real answer to that question because it depends on how the disease affects the person. So you could have a very angry and, again, belligerent husband because of the dementia that he has. But if it were another type of dementia, I can't say that he would be the same because we don't measure behavioral disturbances across dementia, so there's no way to answer that really, other than really to speak with your provider.
Thank you.
Remote sites, do we have any other questions from you? No? Okay. Any other questions in the room? Well, thank you very much, ladies and gentlemen.